increasing, and that's
Hmm.
why I am having some problem in walking. And if I walk a lot,
Hmm.
then there the problem creates, it swells, knee swells and it pains. Then
Hmm.
for the next day I am like almost can't
In
do
bed.
that
Hmm.
much of walking.
Hmm.
And
Hmm.
another thing is that in my elbow of late I've developed some swelling and pain in the joint of the elbow.
Hmm.
That's
Hmm.
also the same thing. If I give some hot water or hot
Hmm.
massage on my elbow, then it gradually reduces. But the pain still persists in the joint. So what should I do about it?
So mainly, see, what I would advise is basic two things. Only you need because as you told, your synovial fluid in the knee is reducing, and you are starting having osteoarthritis in the knees. So basic treatment options of exercises, physiotherapy, weight loss, and calcium and collagen supplements. These are the basic treatment that you require for your knee as well as for your elbow. If
Mhm.
your arthritis stage is too high, meaning it is the arthritis is too much, or the it is too worn off, then we think of next solutions of invasive solutions like injections, stem cell injections, be it surgeries. We have a lot of surgeries that can prevent joint replacement surgeries. So multiple options are there. So you can consult your doctor. Obviously, if x-rays are done, he will explain you what is the stage of arthritis and what are the options that we have at your stage. But in general, what we need is calcium and collagen supplements, exercises and physiotherapy, um, and weight loss. These three are the common things that will help you.
Yeah.
Okay.
Okay. Thank you.
Thank
Thank
you,
you.
doctor.
L- l-
And can you
let's.
suggest the calcium and collagen supplement?
So,
Anything what you would
so a
suggest?
so a common brand that everyone knows, Shellcal. So for joints, there is one Shellcal joints, Shellcal
Okay.
joints. So you can
Okay.
use that, which I think so should be available everywhere. The name of
Yes.
the tablet is Shellcal joints. So there is Shellcal
Okay.
plain shell cal 500, shell cal CT, HD. So there are multiple types. So shell cal joint is specifically for joint pain, which has calcium and collagen. So that you can
Oh.
take. That is a
And
very
how
good.
many times a day you would suggest
Once a day, minimum 3 months,
after lunch?
after lunch or after dinner.
Okay. Thank you so much.
Okay.
Yes,
Thank
thank you.
you. Yeah. Okay. Let's make our questions quick and brief so everybody gets to ask. Yeah. Anybody else wants to go ahead and ask? Please unmute quickly. Doctor should be leaving us in few minutes. After taking DEXA scan, should we go to a physician or ortho? There's a question in the
Uh,
chat.
yes, so mainly DEXA scan is interpreted by orthopedic surgeons. It can be seen by physician, but mainly these treatment options are mainly more studied by orthopedics. So ideally, you can meet a orthopedic surgeon. DEXA scan is reported as -1 to more than -2.5. So -1 to -1.5 is around normal. 1 point minus 1.5 to -2.5 is osteopenia, meaning reduction in density, and more than -2.5 is osteoporosis. So mainly this -2.5 and more DEXA scan should be treated with these injections as well as medicines. And if it is just -1.5 to -2.5, ideally with exercises, with medicines, tablets also, it should be fine.
Right. Yeah. Any other question? Please unmute and ask quickly. Yeah. Any other question? Yeah. It's very important. Doctor, what are the kind of fractures that seniors usually experience? And can you tell us something about hip fracture and what are the
Yeah.
options available?
Yes, so very good question. There are three common fractures in old age. Old age, I would say 65 plus age. Okay. One common fracture is a hip fracture. Second is a wrist fracture, and third is a spine fracture. Mainly when a person is falling, the first point of impact mostly sometimes is the hand. We put our hand, and that's why we
Mm.
fracture our wrist. So
True.
a common Colles fracture where the wrist is deformed. Sometimes we need some manipulation. Sometimes we need surgeries for that. Second
Mm.
common fracture is a hip fracture. The ball, just below the ball there is a fracture. In old age the problem is fractures, bone density, as well as healing potential. Because of that, most of the time we have to replace the ball so that we can mobilize and we can make the fractured patient walk immediately, so that their bone density, their other medical problems are not no, no, they don't get too many medical problems. Because if we keep them on bed for a long time, multiple medical problems can start. So hip fracture and wrist fracture, these are the common fractures mostly which requires some form of treatment and surgeries. Spine fractures, mostly what we call it as osteoporotic compression fractures. The bone compresses on itself. Most of the time it is treated by rest and medicines only, and very very rarely requires surgery. But hips fractures at older age are a major injury, and should always be tried, to be avoided. Commonly, if there is loss of balance, or the patient is kind of tripping always, we advise them to use a stick walking cane or a walker, so that their balance is improved and they don't fall. Because this fall mainly happens at home only, not outside. It happens while going to the bathroom, in the midnight, when it's dark and they don't see some sort of step which is there, and they trip and they fall and they have hip fractures. So prevention is important, using sticks, cane or a walker, if they feel that the balance can go. And obviously, to after fall, if to prevent a fracture, keeping the bone density good is important.
Right, right, yeah. Doctor, can you explain any question? Anyone? Prince, please go ahead because doctor's time is very important. Unmute and ask quickly. Yeah, doctor, can you tell us about the hip replacement fracture, which is quite amazing that the entire hip can be replaced, and some of the things that have now come in, new trends of operations that are there, unlike the conventional or tradition fracture operations. Can you, which you specialize in also, can you tell us a bit about that?
So, hip replacement surgery are of two types. One where we only replace the ball. The ball is fractured, the cup is good and intact, the ball has fractured, so we only replace the ball. Mainly partial, this is called as partial hip replacement, and this is required mostly in older age, because the lifespan is only 10-15 years of the implant that we use. And for younger patients, if unfortunately they have this kind of fracture, or they develop hip arthritis, then we what we do is a total hip replacement, where the cup is also replaced, the ball is also replaced, and this lasts more than 25 to 30 years. Now obviously with advances, the ball that we use mostly a ceramic ball and a cup which is of very good quality, which can last for more than 15 more than 25 years and all. And don't matter. And the techniques that we are using, with better techniques and understanding, with minimal invasive, also what we are these days using is a direct anterior approach, meaning instead of going from behind the hip where hip dislocation chances are more, we are going from the front where the hip dislocation chances are very less. The recovery is very fast, meaning if we are doing the surgery today, by evening the patient, after surgery of hip replacement, by evening the patient is sitting, and by the next day patient is walking, and
Wow.
and we discharge within couple of days, and when we discharge the patient is walking without support. That is
Superb.
the confidence or the technique that we are using, so that he doesn't even require support also that way.
Yeah. Thank you. Yeah, Brother Sunil, quickly. Doctor has to go. Maybe Brother Sunil
What
and John Raj can ask questions back to back, and then Doctor can finally reply and go. Yeah.
Yeah, sure.
Yeah. Sunil, please go ahead.
wha- doctor, what type of food will be good for people with these symptoms?
So mainly general food, I would say. What we have been told that these are good foods like vegetables, dry fruits, milk and milk products. These are good. We need good amount of proteins also. If you are vegetarian, mainly protein source again becomes milk and milk products like paneer, soya, and all. And if it's a non-vegetarian source, good sources become eggs and fish also. But for main bone health, we need more of calcium, which mostly comes from milk and dairy products only. So milk, paneer, these types. They.
Okay. Yeah.
Is tofu good?
So
Tofu.
tofu is also kind of a milk product only. It's similar to paneer. It is good. Uh, uh, I would not comment it is better than this or better than that. It is good if you can take. It is better than just dal chawal. That I would say.
Okay. Thank you.
Okay.
Yeah. John Raj, quickly, please. Brother John Raj.
Yes, thank
Yeah.
you, doctor. In short, I had a hip bone fracture 2 years back. So I
Hmm.
am being fitted with titanium Famicol the screw fitting.
Hmm.
Now, the thing is that so far so good. Like now, 2 years passed, I am come back to normalcy. But the thing is that around 6, 7 years back, I had a right leg that is below the hip and above the knee. So
Hmm.
now it started paining. So last week I had an X-ray of both the legs, but in the X-ray it is not showing anything.
Meaning you
Okay.
have thigh pain now.
Brother John,
Hello. Yes.
can you respond quickly? Do you have thigh pain now?
Yes, I'm having pain at the right leg now.
So,
Hello.
Yeah. Go ahead.
huh.
Uh, no, see, right
You
leg
were.
I had a fall 6, 7 years back, but
Hmm.
that
Yeah.
time it didn't show any fracture. Now also I removed the X-ray last week also because so I thought better I'll take X-ray. So it is showing
Your
nothing.
your audio is fluctuating, Brother John. Please speak close to the phone.
1 minute, 1 minute.
Yeah. Yeah.
Yeah.
We do. Doctor doesn't have time. Yeah. Doctor, you
So,
No,
can
no, one
start.
call is coming. That's why the drop is there. One call.
huh.
Yeah. Doctor, you can
Now you
go ahead
can
and
hear me.
explain.
Now you
Yeah.
can hear.
Yes. Yes.
Yeah.
Ah,
So, see, we need to diagnose what exactly your problem is. If you say your X-ray was normal, we have to find out if the pain is originating from the spine. Do you have any nerve problem, or you have a local kind of a problem, meaning there is a hip problem or a spine problem. So, ideally, you will have to be evaluated by the orthopedic surgeon properly. If required, MRI, if it is possible, the implants, if they permit, can be done to see if the problem is. But if the x-rays are normal, meaning there is no fracture right now or a problem, but obviously we need to evaluate. So we need some
okay,
more
fine.
investigations. This is what I would say.
Ah,
Right. Right.
and,
Yeah.
and this
Yeah. So
left leg hip bone nail fixing that won't be a problem for the lifelong, no? Because
Uh,
that's
so
what they told.
so if yeah, so if they mostly what we use are titanium implants. So if
Hmm.
it's a titanium implant, we don't need to remove them. Also, an MRI can be done with titanium implants in our body. So if that is the case,
Okay.
there is no problem. We can leave it as it is throughout the life.
Okay.
Because that's what
Thank
doctor
you.
told me.
Yeah.
As the age is
Yeah,
picking up, it is
Dr. John,
permanent.
Brother John, please stop now. If you are done,
Okay.
quickly finish. Doctor has to go. Yeah.
Okay. Okay.
All right. Thank you so much, Dr. Rohan. Thank you for your precious time. God bless you.
Thank you so
Yeah,
much for
you can
calling
log
me.
Thank
out.
you.
Thank you so much
Thank
for
you.
calling me. Thank you.
Yeah, yeah, yeah. Thank you very much. Thank you so
Thank you.
much.
Thank you,
Yeah,
doctor. Thank you.
yeah. So we look forward for more sessions with Dr. Rohan. Let's see in the future. But you are have any, please join with us. And if you are here for the first time, do be in touch with us. NMBF Coffee Chats. Yeah. Thank
Definitely.
you.
Thank
Bye.
you